Good afternoon and good morning to everyone calling in from across North America. Thank you very much for joining us today for our webinar. My name is David Denker from Zencity. I'm really grateful to bring two guests, Blair Bryant and Madeline Cohen, who you'll hear from a bit later, to share a bit from their experiences, and also want to welcome all of you calling in from around the country. So I first want to start off by saying, wow, we're here. Who would have thought 9 months ago that we'd be talking here even before the end of 2020 about successfully and how to successfully distribute a COVID-19 vaccine. Really what an amazing moment where we've arrived to right now. And we're starting to see perhaps the light at the end of a dark tunnel, which is really great. But as we all know, the path ahead remains very difficult, uncertain, and challenging. And so with that, I first just want to say thank you. Thank you to all the people on the call, all of our partner communities, the people who work in local government, who are on the front lines for the hard work that you do year round, even before COVID, protecting public health, making sure that your communities are strong and prosperous and growing. And it's really thanks to your hard work that we're going to get through this and that we're hopefully going to grow stronger together. And so thank you for all you do, and also especially thank you for being here today. The challenges of facilitating and encouraging our communities to get vaccinated is not only the largest public health logistical effort being managed by government and particularly local government, it's perhaps also the largest communications challenge that we've ever faced in our histories. We all know that mistrust in the vaccine is an extraordinarily serious concern. And like most of the COVID response to date, getting our communities to cooperate, to trust in science and in experts, and to address misinformation and even innocent confusion is really key. And so with that, we have the unique opportunity today to share some of the Zencity data that we've been seeing from across North America over the last couple of weeks. And we'll also have the opportunity to hear from our two esteemed colleagues who have joined us today to speak. But also we really would love to hear from your experiences and your questions that you're facing in your communities around the country. For what you're saying. So please, I encourage you to ask questions, to raise some examples and tips that you have. I think a lot of people, we're all on this call, we're all very eager to learn and listen. And so to really share what you've been seeing. With that, and before we kick off, a few words about Zencity. Local governments across North America use Zencity to better understand what their residents are saying. And importantly, to make more informed and data-driven decisions on a wide range of issues that they face, from police-community relations to waste management and public works. Zencity helps communities monitor discourse from a wide range of channels, whether they be on official city channels or county channels, but also importantly on unofficial channels where residents themselves are speaking. It helps you get beyond those loudest voices in your community to track resident sentiment and of course identify sources of confusion and misinformation. And this allows your teams to react, adjust policy, adjust messaging in real time. We do this by aggregating millions of data points across a wide range of channels of information. But not only do we aggregate it and bring it to one place, is we organize it and categorize it and help it make sense so that in the end of the day, you get actionable insights that drive policy and help make your policymaking and your connection with your residents better and stronger. And so for those of the communities that are already working with us, you know well that there's already a project now on your dashboards to help you track the COVID vaccine discourse. You can see that live today. And so please, I encourage you to go in there and see what's going on and reach out to us about any questions you have about how to manage that moving forward. So looking at a national level and to set the stage for our conversation, what is the data telling us? We looked at the last about 3 weeks worth of data across North America from communities of all different shapes and sizes, red states, blue states, large communities, small counties, rural counties, big metro areas, to see what people are saying. And unfortunately, it seems that there's a lot more skepticism being expressed than optimism or excitement. We can see some of the popular words that we've seen from the last couple of weeks, a lot of mistrust, fear, and perhaps even resistance to getting the vaccine and listening to some of the public health experts. Some of the top issues that we've seen raised and concerns, and this really again is across all different types of communities and shapes and sizes, and this is probably not surprising, but we're really seeing this as quite consistent, is concerns with the development and speed of manufacturing of the vaccine, how the trial process. People are saying they don't want to be a guinea pig. They're afraid of some of the side effects. And there's fears about vaccine mandates being, and then perhaps the infringement on specific civil liberties. These are things we're seeing across all different communities from across the United States and North America. Unsurprisingly, discourse about the vaccine is on the rise. As the vaccines rolled out of one of our partner communities in Kalamazoo, Michigan, from the Pfizer factory, we see the discourse picking up. But when we break it down, we can see that a lot of the discourse is being led by news outlets, and official sources are lagging behind. What we're concerned about when we see this information nationwide is that it leaves a lot of room for misinformation and skepticism to really take hold. And what we see here with this graph here, and also with the next one, where we see kind of news media dominating and also organic resident discourse, but a much smaller share of official discourse. What we really see here is a call to action. Local governments have to take control of vaccine messaging now in order to make sure that residents feel comfortable and to comply. And that's going to be, I think, one of the key themes that we hear from Blair and from Madeline going forward, that the time to act is now. And that's the critical path for successfully, hopefully bringing an end to this horrible, horrible pandemic. And we'll talk a bit later about how we're also helping track the effectiveness of those kinds of messaging on a local level. But first, we'd like to hear from our experts about their experience. And so we'll first turn it over to Blair Bryant. Blair, well, thank you so much for joining us. Blair is the Associate Legislative Director for National Health Policy at the National Association of Counties, NACo. She works with county officials across the United States to help set NACo's policy agenda in Washington on matters relating to healthcare and the public health system. And we know that Blair's colleagues in NACo have called her the vaccine queen. And so we're really eager to hear your perspective, what's going on a national level, and some tips that you perhaps have and questions for our colleagues around the country. So thank you, Blair, please.
Thank you. And thank you to my colleagues that snuck that into my bio. Good afternoon and good morning to you all, depending on what time zone you're joining us from. I'd first like to thank Zencity for coordinating this webinar and inviting me to participate on behalf of NACo. Before I jump into my remarks, I wanted to quickly provide an introduction to NACo and some background on the role that counties, not just with regard
Wait, I'm sorry, Blair, you got you muted by accident. Sorry, you were saying NACo.
Right. Can you hear me now?
Yeah.
Okay, perfect. So I was just saying that I wanted to back up a little bit and provide some background on not only the role of NACo, but the role of counties in protecting the overall health and safety of our communities. So NACo is the voice of all of America's 3,069 counties, and our mission, as well as our goal, is to achieve healthy, vibrant, and safe counties across our nation. And to accomplish this, we're always working to both foster and strengthen the intergovernmental partnership at the federal, state, the local level, as well as with our other local governments, which is especially important in times of crisis like this one. In the same vein, I wanted to set the stage for the role of counties with regards to vaccine planning by discussing the key role that we're already playing in administering local health services. Counties play a role in nearly every health safety net service at the local level, which includes local health departments, hospitals, nursing homes, long-term care facilities, as well as even behavioral health facilities. So when it comes to COVID-19 response efforts, because of their involvement in local public health, counties have been critical partners with states and other jurisdictions in mitigating virus transmission. Whether it's securing PPE for healthcare and public health workers, standing up testing centers and mobile health units, leading contact tracing efforts, or working with collaborative intergovernmental partnership teams across county and state lines. However, despite the innovation and resourceful work that we're seeing at the local level, counties, like other jurisdictions, are facing ongoing challenges with regards to local response efforts that will continue to impact both our COVID-19 mitigation efforts as well as our vaccine program implementation efforts. So on the next slide, we really outlined some of the challenges being faced by counties currently. Counties support over 900 hospitals, 824 long-term care facilities, and nearly 2,000 local health departments, which all will play an integral role in vaccine distribution. This will likely come as no surprise to anyone on the webinar, but one of our biggest challenges revolves around resources, which actually includes both financial and human capital. The federal government will cover the cost of purchasing vaccines. However, counties and local governments will be responsible for the cost to administer the vaccine. Having a vaccine is not effective in combating COVID-19 without vaccinations. And the infrastructure that needs to be created around the distribution of these vaccines that would allow for mass vaccinations to occur is extensive, to say the least. And under normal circumstances, upstanding an immunization program of this magnitude would be intense and would require significant resources. The Centers for Disease Control and Prevention has released approximately $200 million in funding to states and local governments to date for vaccine planning efforts, much of which unfortunately did not reach county health officials. However, aside from this allocation, state health officials are estimating that approximately $8 billion will be needed in total, which would be used for things like workforce recruitment and training, cold supply chain management, which includes transportation, storage, equipment, and training for staff, as well as technology and data system enhancements, which will definitely be needed for vaccine tracking and second dose reminders. So the approval of the Pfizer vaccine, while exciting, comes on the heels of ongoing negotiations by federal lawmakers about the next round of COVID relief. And actually, they're still in conversations as we speak this very moment. As some of you may know, Congress is on the verge of reaching a compromise that does not include additional aid that would go direct to counties or other local governments. This additional aid is critical given the dual role that counties have in both mitigating COVID-19 while also being the key administrators of the vaccine. One of the potential solutions to resource shortages would be to leverage existing COVID-19 funding streams. The Centers for Medicaid and Medicare Services has indicated that recipients of the $175 billion Provider Relief Fund, which was established under the CARES Act to provide fiscal relief to hospitals and healthcare entities, may be used to cover the cost of vaccine administration for uninsured individuals who aren't eligible for or enrolled in Medicaid. In addition to this fund, the $150 billion Coronavirus Relief Fund, which was also established under the CARES Act, provides state, county, and municipal governments with populations over 500 federal aid to pay for necessary expenditures incurred during the current public health emergency. As permitted under the CARES Act, states and localities may use these dollars towards medical expenses that include vaccine distribution and administration. So we do see some examples of counties leveraging these federal dollars. For example, in Sacramento County, they've allocated a portion of their coronavirus relief funds towards purchasing supplies and resources necessary to effectively distribute the vaccine once it's approved and shipped. We also have seen counties like Pima County, Arizona, use their dollars to purchase facilities to store the vaccine doses once they are made available for future use. An important note about the use of the Coronavirus Relief Fund in particular is that it must be spent within the next few weeks before the looming deadline of December 30th. We have focused our advocacy on the federal level for getting this deadline extended. However, it looks as if that extension was not included in the current COVID-19 relief package that's under consideration. So this deadline will still stand. Beyond funding, one of the biggest challenges we will face as local governments will be communicating. As was mentioned in David's remarks, there's certainly skepticism and hesitancy around the vaccine that could be a barrier to achieving the vaccination rates that will help us to move past this emergency. Public servants at all levels of government will play a huge role in ensuring vaccine confidence. County officials are trusted voices in their communities with the ability to rapidly disseminate information through a range of different channels. One of the most important things we can be doing right now as local governments is planning out how we're going to communicate factual information to the medically vulnerable, the marginalized, and populations with vaccine hesitancy and medical mistrust. A few examples of ways this is taking place in local communities can be found in Yakima County, Washington, who's actually leveraging community health workers to go door to door to Spanish-speaking populations and translating factual information about COVID-19 testing, contact tracing, and now vaccines to these populations. In New Mexico, they're actually adapting the community infrastructure of outreach and partnerships that they used for their work on this year's census for COVID-19 vaccine outreach and rollout. So an ongoing strategy for communication will be critical for the success of local vaccination programs. Lastly, counties are continuing their work to build partnerships with cities and states that would help to share resources and that would leverage local expertise. Most local health departments already provide direct immunization services, with about 90% offering adult immunizations and 88% offering childhood immunizations. So these departments already have a solid foundation of expertise in planning and administering vaccine and immunization programs. And it's important that there's ongoing communication with other levels of local government so that plans are taking place that make the best use of locally established practices and resources. We've also seen great benefit to state, county, city partnerships as we take a look at mitigation efforts as a whole that have been taking place this year. One example of this was the establishment of nursing home strike teams in several states and local communities, which pooled resources and emergency response professionals to help respond to COVID-19 outbreaks in nursing homes. There's several examples of how these strike teams were extremely effective in reducing further infection and death in these facilities after an outbreak occurred. And it's a good model for ways that various levels of local government can work cooperatively and again, pool their resources together. Lastly, I just wanted to share with you all a link to a resource page that will provide insight into the county role in vaccine distribution and planning. And it also highlights several of the examples that I've mentioned today. So with that, I'll say again, thank you, and I look forward to further discussion during our Q&A, and I'll now pass it over to our next speaker.
Thanks so much, Blair, and thank you so much. And we'll have time for questions after Madeline's remarks. But I also encourage people to consider, to think about what Blair was saying about how to reach out to some of those communities that perhaps are not always easiest to reach out to, some of the vulnerable communities, minority communities. And it'd be great to hear perhaps some examples from some of the communities who are calling into the call today. So with that, I'm going from the national level down to the very local level. We're happy to introduce Madeline Cohen, who's the Emergency Management Planner for Cameron County, Texas. Madeline has a lot of experience consulting all levels of government and the private sector on all matters of emergencies, from counterterrorism and health security to day-to-day emergency management. So Madeline, great to have you here. And yeah, could you please tell us a little bit about Cameron County and your role there? Thank you.
Absolutely. Thank you so much, David and Inbal, and thank you to Zencity for offering me this position today to speak with you all. I'll try to keep my remarks brief so we can really dive into the Q&A. But if you're not familiar with Cameron County, Texas, we are the southernmost county in the state of Texas. So we are right on the border, right on the coast. So yes, people do live down here. It's usually pretty sunny. It's a nice place to live. But as Blair was discussing and David just mentioned, it's really important to reach out to these vulnerable communities. And we do have a lot of these communities that are vulnerable or are hard to get a hold of and hard to contact for many reasons, which I will discuss. And so we're really trying to come up with unique solutions to not only educate the public about the vaccine, but to also go ahead and get the vaccine distributed to people. So that's kind of a little bit of background on myself in Cameron County, and now I'll dive right into my remarks. So you'll see here, education really is the key. I know Blair just spoke about it a little bit, and I'm sure all of you are also experiencing this right now in your local communities and in your counties or local jurisdictions. But our main concern right now is just getting the information out, right? As we saw earlier, like the media is the loudest voice right now for vaccines and for the vaccination kind of campaign. And so it's really just important to get the information that the government wants out, to push it out, right? Like we want to kind of speak over the media, if that makes sense. And I'm not saying that obviously the media doesn't have the correct information, but we are the government, and this is the information we want our residents to know. So right now, at least in Cameron County, we're really focusing on a very strong public information campaign to kind of quell the misinformation, to manage rumor control, and make sure everyone has all of the facts. And as Blair mentioned, it's really important to make sure that that education material comes out in different formats, right? She mentioned one county, I believe in Washington State, and the health educators are going door to door to those Spanish speaking populations. Well, here in Cameron County, a large portion of our population, English is their second language, or perhaps they don't speak English at all, and they only know how to communicate in Spanish. So we have to put information out in Spanish. If you have residents in community that are maybe deaf or hard of hearing, it's really important to put ASL information out, things like that, for just all of the different communities to make sure that they're really getting the information you want. You'll see here, cross-agency cooperation is all about who you know. That's definitely true. I think at least down here in Cameron County, we've really had to work together as a team between all of our county departments, all of our local jurisdictions and cities, and then of course with the state of Texas. We don't interact too much with the federal government outside of the actual CARES funding. We're very lucky that the state of Texas kind of does a lot of that communication for us, and so we mostly deal with them. But it's really important to keep that communication line strong, and I would really encourage everyone to chat with their public health directors or chat with their hospital preparedness program representatives. HPP has been a really huge advocate for us, and they're very helpful. So I would really encourage that as well. I think it's just important right now to just build those strong relationships now to start working out those kinks. So that way, when your local jurisdiction does receive the vaccine and when you're ready to start distributing, you already have everything all planned out, and you're not at that moment calling and trying to figure everything out when it's already too late. So thanks for changing the slide. You'll see here a couple of more facts, right? So you may need to run more than one campaign at once. So right now, obviously, we're really focusing on getting out that vaccine information and that vaccine trust to the residents, right? But not only that, we need healthcare providers to administer the vaccine. At least here in the state of Texas, the way the vaccine distribution is going to kind of work is that healthcare providers are going to be the ones doing that. And so what does a healthcare provider mean? Well, you have to go through several steps. You have to register with the state of Texas immunization registry. You have to prove that you have the cold storage capability. You have to prove that you have that data management capability. You have to prove that you have all of these supplies. And so we're really trying to reach out to those healthcare providers now. And we've been doing this for several months, but now it's kind of the push that we have the vaccine, and we can see the light at the end of the tunnel. So we're really focusing on getting that provider recruitment up. Obviously, the more providers that you have to distribute the vaccine, the better. And I think that's also really important, especially down here in Cameron County, where a lot of people may be distrustful of the government, or we have a lot of undocumented residents down here who perhaps don't want to show up at a doctor's office, or if they hear the state of Texas is involved, maybe that's a little scary for them, but they trust their local leaders, and they may trust their community doctor or something like that. So it's really important to kind of get the message out now. You'll see here again, the facts, hit everyone with the facts every single day. That's what we've been doing, right? We have been managing this public information campaign for a few months now, and now we're really trying to hit it hard. Again, we really try to quell that the rumor mill, manage rumor control, and manage that misinformation. Luckily down here, a large part of our population may not have, I shouldn't say luckily, but they don't have that access to social media that some other populations may have. So most of their information does come from mainstream media, like the news, right? Television news. They're not necessarily on Facebook every day. So that's helpful for us, but then that's also challenging for us, right? If a lot of our population doesn't have social media, how are we supposed to get that information out to them, right? And so that's something that we've run across. And then I think to really hit home on this last point, to make sure that everyone is broadcasting the same message. And when I say everyone, I mean from the state level to the county level, to the different county departments, even to the local cities or local jurisdictions. We meet pretty regularly, multiple times a week, with our public health department. Here in Texas, we have county judges that are elected officials with our county judge, and with the individual cities and jurisdictions that are within the county, to make sure that we have crafted a unified message. And that way, it doesn't matter if you live in X city or Y city, or if you live in a rural county area, you're still going to be getting the same information, and it's still going to be like the same message distributed. I think there's one more slide as well, David, perhaps?
I think that.
Nope. So I'm sorry about that. Just to wrap up, I think on that same message page, I think it's really important to leverage those county officials, right? So you have elected officials, the public voted for them, you know, so they presumably trust them and think that they're going to do the right thing, and they care what they have to say. So something that we do here in Cameron County is we trot our county judge out, and he has a press conference every other week, and he'll pull out our health authority, he'll pull out doctors, he'll pull out the public health administrator, or maybe even other just community leaders to try and say, hey, you guys trust me, you voted for me, here are some other individuals that I trust, and to kind of perpetuate the message that way. So I will leave it there. I look forward to the Q&A. I hope I didn't bore anybody too much. So that'll be my piece for now, David.
Thank you so much, Madeline. So yeah, so we have some questions coming in, but I wanted to ask kind of what's the role of data in your planning, your communications? I think, you know, if you could say a few words perhaps about that and tracking kind of what you're doing and how you plan things moving forward.
Absolutely, definitely. So Zencity has been very helpful in this kind of data management piece. We do have a county public information officer, but obviously she's very busy. She has a lot of things to do. So it's really helpful that Zencity does kind of collate all of this data for us. And so you'll see here, you can see our number one media source on the bottom right of your screen is KRGV. That's our like main news channel down here in the Rio Grande Valley and in Cameron County. And you'll see that like a lot of the sentiment is negative, and that's really challenging, right? But it's helpful to see, okay, residents are having this negative sentiment. What is it about, and how can we change it? And so we'll kind of take some of that data that we'll see. We'll take some notes, jot some things down, and then that will inform, usually it will inform a press release that we'll put out, and then our county judge, Eddie Trevino, he'll hit on that in a press conference. And so like I said, he has press conferences usually about twice a month. And the topics for those press conferences are usually determined by like what people are talking about and things like that. And so that's kind of how we utilize our data down here.
Amazing. Thank you so much. And I'll say, I think this is the next chapter, the next slide that we wanted to show away with some of the summaries from our prep calls, was some of the kind of key takeaways. And maybe I'll just kind of go through them quickly is go local and emphasize trusted voices. To be proactive, as Madeline said, to just talk, and don't be afraid to repeat the message over and over again. And of course, we'd like to hear some examples from reaching out to vulnerable communities. And with that, we're going to open. Oh, I just wanted to point this out, an interesting data point, going both off of, especially off of what Madeline said about the trusting the local county judges and officials, that we're seeing here data that mayors are a main source of information up till now. So that is, as you both mentioned, you know, those trusted elected officials, they do have a place, they do have a voice. And with that, you know, we encourage you to go out and other local figures, maybe the religious leaders, community leaders that are doing that, but to take advantage of that. And with that, I also wanted to we have two, you know, people work with counties a lot along the line of mayors, is that, can you speak a bit about the challenges and how you see counties, how counties and mayors within the county district, perhaps city mayors, should be working together to do this, and kind of maybe there you have some tips and some experiences that you've both seen over the last couple of months. So maybe we'll start with Blair. Yeah, thanks.
Sure, I'll jump right in. One of the partnerships that would be essential in terms of messaging, I say, would be the county and the city. They tend to have a lot of crossover in terms of their functionality and do a lot of on the ground work. So I'd say that cities and counties have the extreme advantage of having really close proximity to their constituents, more so than maybe a state governor would, or anyone in the state legislature. So I think that they can leverage that by getting on one accord with their messaging. And that's one of the things that I was going to share as a key takeaway, is making sure that your state, your city, and your county, like Madeline said, all are on the same page and are saying the same talking points. And additionally, cities have more resources to be expended in terms of reaching people through a budget that may be specifically designated for communication. So pool your resources together. Make sure that your county is working with your city to pool resources resources on your communication strategy in particular. Make sure that your communications are being well placed. I think that cities have the advantage of kind of knowing the population tracks, meaning knowing where the majority of their population goes to work and then goes home. Counties have the same advantage, but working together, you can reach a wide range of your population by making sure that those messages are placed in places that people will actually see them.
Thank you. Madeline, do you want to add to that a little bit about making sure that seeing that your message is in different forums?
Absolutely. I mean, I would certainly echo everything that Blair said. And I really think the city mayors they're going to be the key for getting information out to those residents in the cities, right? So our biggest city in Cameron County is Brownsville. It's about 250,000 individuals, right? So if we're trying to message to Brownsville residents, we found that it's easiest for us to get to those residents by using the Brownsville mayor and the Brownsville Public Health Department. Those are the individuals that those residents interact with most frequently, right? But we also have a lot of rural areas in our county, and those people don't fall into a city. Like, they don't vote for a mayor. They're just, they're just in the county area. And so you have to make sure that you're reaching those people. And so I think, as Blair mentioned earlier, that may be knocking on doors with those county health officials. That may be flyering. We do a lot of just paper flyers. As I mentioned, not all of our residents have social media. A lot of our residents don't even have smartphones. Like, they don't even get on the internet on their phone, right? So they have the television and they have paper flyers. So we do a lot of that. We'll print information out and we'll put it in their mailbox. We'll put it on their door. We'll put it at the local community center, maybe the laundromat or the local grocery store. And that's really worked for us, at least in those more rural areas where the individuals are less likely to see the news or hop on Facebook or something like that. But I do think that the mayors are definitely key for reaching those city residents. I would definitely agree with that statement.
And if I could add on to something that Madeline just said, one of the things, thinking about myself personally, I live in a bedroom community right outside of DC, but I work in the DC area. So obviously the city of DC is controlled by the mayor. So what I see when I go to work is controlled by the mayor. And then we need those same messages to be translated into my county that I actually live in, so that when I'm at the grocery store and, as Madeline said, at the laundromat, I'm seeing the same messages.
Great, so thank you so much. So just a quick question about Zencity. Do we help track social media? Yes, we help track all matters of digital discourse from residents, whether it be social media, but also we help cities and counties organize data that they have also in-house. We do a lot of work around that as well. So yes, we do. And the question we have from there is that we see that vaccine providers have indicated that they don't have enough staff, and that hospitals are also concerned about being short-staffed on handling COVID patients and other responsibilities that they have. So have you any thoughts about how to address or prioritize staffing challenges? Sorry, Blair. Yeah.
I would say this is where intergovernmental partnerships really comes into play. Pooling staff resources right now is going to be essential. NACo has talked to a number of different corporate sponsors and providers that are providing apps to kind of facilitate where people live and work and are going every day. So you can send your staff resources to that facility instead of having staff in places that don't get a lot of high traffic or won't see a lot of high traffic in terms of getting vaccinated. So working with your city and working with your state to pool your staff resources and send them to the places where people are more likely to go to get vaccinated would be an important strategy for combating staff shortages. But it's definitely a problem that we're seeing all across the board.
Okay, great. A question from Kelly Brady from Victorville, one of our partner communities, asking about messaging strategy. She says that playing with residents' emotions has worked pretty well up until now. And so, for example, if you say instead of saying get tested or wear a mask, we say protect yourself, protect your loved ones, protect your community, and let's do our part to protect our loved ones. And so she asked, do you have any questions about how this type of emotionally charged messaging may work around the vaccines?
I think I can speak to that. So I would definitely agree, at least in our community down here, they're also, our residents also kind of respond to playing with their emotions, protect yourself, protect your community, protect your loved ones. And especially down here in Cameron County, at least, we have a lot of multi-generational households. You have several family members living together, and we kind of utilize that, like you got to protect your household, right? Protect the people you live with. And so I think that type of messaging has also worked really well for us. And we're kind of planning to perpetuate that throughout the vaccine. We're kind of looking at it as like a protect Cameron County sort of thing, where we're grouping the county as a whole, right? We're Cameron County strong, together united. We even came with like a little hashtag for COVID, and as dorky as it is, it definitely works. And just perpetuating that we're all in this together. We're going to get through this together. We've come this far. Just kind of finish it out, like let's finish strong together is something that has really worked for our community down here, at least.
And I just want to follow up with that. Have you seen the other organizations in the community have kind of picked up that message? Is like you put that out as like an official hashtag or slogan, but have you seen other groups kind of pick that up?
Yeah, definitely. So most of our county departments have picked that up. A few of the physicians at the hospitals, some of the hospital CEOs, we work with them very closely as well, as you can imagine. So they kind of put that message out, Cameron County strong, like not necessarily like this hospital versus that hospital, it's kind of more of like a regional thing. So yeah, I would say that throughout the community, some other organizations have picked that up. Yeah, I would say yes.
And I'll say also, just to add from our experience, that when communities have done these kind of messaging campaigns or hashtag campaigns, that we do see an increase in positive sentiment. We've seen that track really across, again, all different types of communities of all different types of backgrounds and populations. And so I think sometimes we may be a bit cynical and think that those things seem a bit silly or, kind of a waste of time, but we really do see it works. And again, as Madeline said, to keep repeating the same messaging over and over again, we also do see that repeating those kind of messages and appeals to emotion really are effective. And that's something that we are seeing kind of across the board. So I think I keep it up. It seems, even if it seems a bit daunting. Excuse me. So we have another question. We see some municipalities using volunteer forces for vaccination events and drives. Do you have any insight or any experience with language and messaging around training and briefing volunteers? I don't know if we've seen that yet. Have we seen that yet on the national level, Blair? Is there talk about that among counties?
Absolutely. Yes, there is actually. So CDC is developing training modules for healthcare providers to administer the vaccine. I think that's a great question. The problem that we are going to encounter with this vaccination program in particular is that there's a lot of local public health and local health agencies that are enrolling in their vaccination program that may have never done a vaccine program to this magnitude yet. And then also we have some very specific information that we need to know about each of the vaccines. Pfizer in particular has some very complicated logistics in the way that it's stored and can be used. So training is going to be essential, whether it be for volunteers who are helping to do vaccinations or volunteers who are disseminating vaccine information. We need to make sure that we're hitting all of the right talking points. So I will point you in the direction of the CDC, who has released not only a communications toolkit for healthcare providers and health agencies, but they've also did a training module for healthcare providers in doing the COVID-19 vaccine. I will also say that each of the vaccine manufacturers, so Pfizer, Moderna, in addition to their approval or authorization, they will have specific information for vaccinators to use their vaccine. So that information can be accessed through their website and resources, and NACo will put that information on our website as well.
Great, thank you. And what about organizing on the local level, Madeline? Have you seen that yet?
So we're kind of working on that right now. That's what we're one of our main priorities is. And so I think what our plan is to take volunteers from our county, right? So I mean, I work for the Office of Emergency Management. Obviously, I would volunteer, right? But we have a lot of people from the Cameron County Elections Department, and they may not be as busy right now, like the election season just ended. And so we're working to recruit from within the county because kind of reach those people, right? And we can get that messaging and we can get that training to them. And we know that these people are responsible enough to take that information and do good with it. So that is something that we're working on right now. And as we work through it, I would be happy to provide updates, in the coming months as we work through it. But right now, our plan is to pull from other county departments, should we need to, right? We may not need to, if all of the doctors are able to manage it at their own clinics. But should that be necessary, that would be our plan.
Great. We have another kind of a good question here from Adelphia from Minnesota. She asks, for the most part, counties are really the responsible agency for public health, but sometimes, and Adele, I know works for the city, are sometimes slow to respond. So do you have any advice for kind of reaching out to get more information released, or working with perhaps in a situation where the relationship between the city and the county is not the best? Do you have any advice for city officials, how to work well in getting that message out?
That's a tough one. I mean, I think it ultimately, and fortunately or unfortunately, it really depends on your relationship with your county officials. So down here in Cameron County, it's a large county, but everyone kind of knows each other. I know that guy because I used to work with him, and so I'll just call him. And so a lot of our communication with our cities is kind of done like informally, not necessarily like, let's have a big call. Obviously we'll have conference calls. And I do think that regular conference calls and regular touch points are very important. So I would definitely encourage that. We meet at least at minimum weekly with all of our city mayors, city emergency management coordinators, and actually also school district superintendents as well. So I think at a minimum, that's really important, just to make sure everyone's on the same page. But if possible, if you can kind of start establishing those informal relationships. And so that way, like, if you have an issue, but, oh, I just talked to them last week and I know them, I think I could just give them a call and it would probably be okay. That really works for us down here. It might not work for everybody. So I want to definitely put a disclaimer there that it may not work for every city or county relationship, but down here, at least, it's a lot of informal communication. But I would really recommend at least weekly. I know everyone's really busy, so maybe not more than that. You don't want to start like wasting people's time, because then, people are very protective of their time, as I'm sure all of you are. But I think at a minimum, it's really important to just kind of give an update of where the county is. And then we also hear from the cities. We give each of the cities, we have, I think, 17 incorporated jurisdictions in our county, and we give each of them their time to speak every week. And if it runs over, it runs over. And I think that's the way that we've really been able to bolster that relationship with the cities. So as a city official, I would just encourage you to continue to reach out. I mean, I'm sure that your county officials are very busy, but like, this is also their job, right? Their job is to interact with you. And I think if you just kind of gently keep reminding them, that would be my recommendation.
Blair, do you have any tips, kind of best practices maybe from NACo?
I do. And of course I have to stick up for my counties here. I will say that counties are often understaffed. So with regards to communications, they often don't have one person just working on communications and pushing out that information. That person is wearing multiple hats. I think we've especially seen that during the pandemic, with many of our local health department staff being pulled away to do other emergency activity at the local level. So I would say patience is key here, but also at the federal level, there were working groups established, or there were supposed to be working groups established for vaccination program planning in particular. That was a part of the CDC's jurisdictional playbook. They said that you were supposed to establish internal and external working groups to talk about, communicate, and plan for vaccine distribution. So these working groups were supposed to be made up of both city and county, as well as state officials. So that's more of a more formal structure to which to communicate with the county if you can't get them informally. And then also beyond that, beyond the requirement, we've seen many of our counties starting to form these kind of informal partnerships and task force with their cities in particular and other counties in their area to share information, to make sure they're all on the same page as it relates to messaging, and to also pool staff resources. Like I said, pooling, if you have one county that has a designated staffer for communication, they can definitely assist with other counties and cities in that area in developing communication strategies and pushing that out. So these informal and formal partnerships and task force are essential for allowing that communication to occur.
Yeah, thank you for that. I also encourage, so some of these other questions, I also encourage perhaps some audience participation. If you want to chime in with some of your experience, you can raise your hand and we can call on you, or you could type in the chat. We have a question from Brandon Babb from Anchorage, Alaska, another one of our partner communities, asking for any success stories about combating vaccine misinformation on social media. Do we have any examples of any success stories for that? I don't know, maybe Madeline, you've seen some already, or some other people perhaps who are called in today? Or perhaps success stories from COVID-19 and misinformation in general?
Absolutely. So I definitely think that responding to this misinformation is very important. A lot of our cities have pretty robust social media presences. The cities, our larger cities, I should say, our larger cities, and I think that has worked for them. So they will, they'll see a Facebook comment or a tweet. A lot of our cities down here are on Twitter. So they'll see a tweet and they'll just hit them right back, like at City of Harlingen or at City of Brownsville, and they'll just let them know. I can't really determine, I can't tell you like whether or not it works. I don't know what those individuals then think afterwards. But I do know that at least a lot of our cities and jurisdictions down here, and us, obviously, when we see it, we do try to combat it. So hopefully it does work down here at least, but the least we can do is try. Hopefully maybe somebody else in the crowd has some success stories they can share as well.
I'll say also what things that we've seen is that we've been able to help some communities pin down like the sources of misinformation, if it's coming from perhaps a particular community organization or particular news source. We've had some communities who have done some direct outreach to local news outlets who have perhaps posted information, mostly inadvertently, but to say, hey, and they see a story we've seen in Zencity with our project feature, you can kind of zoom in on a specific issue like the COVID vaccine or coronavirus or masks or all different types of things. And they've been able to see, okay, we see this story really is really sticking from a specific, our local NBC affiliate, et cetera. And they're able to say, hey, you know what, there's some mistakes here. Let's reach out quickly before it grows even further. And they've been able to kind of stop some more confusion than misinformation, but stop that from kind of growing out of hand and becoming more really detrimental in the community. So that's one of the things that we really like to stress our communities is to take advantage of kind of the ability to kind of keep a pulse on what's going on all the time. Especially in these really dynamic situations where the information is changing all the time, where you as local officials who are supposed to be in the know are also the information is changing on your end. You have to keep it, you have to make sure that, as things are changing day to day, that you're also seeing that same information is getting out to the community. It's really, really crucial. So yeah, thank you for that question. That's really important. And as any other, and again, I invite anyone else to chime in with some other experiences. We know there are a lot, unfortunately, but also we know there's some success stories with dealing with that stuff right away. I want to ask again, perhaps to Blair, who are some of the best messengers that we're seeing besides local politicians? I think that's a big question that I've heard over the last couple of days is that, yes, we're going to have our mayor, yes, we're going to have our county judge or our county executive, post every day or go on Facebook Live once a week, all these things. But who else should we be thinking about to reaching out into our communities to communicate the message about the vaccine within the community?
That's a great question.
Should we be using sports players, as Brendan says, also from Anchorage? Yeah, local sports.
Absolutely. Local sports players. I'd say one of the best, just coming from a public health background and also a county health background, one of the best messengers for any health message is really the faith-based community. So faith-based communities are often, buried within the community and have a lot of those close ties to community residents that more so even than, their elected official. And So they are really the best messengers to push out information and and they're looked at as trusted figures within their community. So I'd say leveraging the faith-based community. So the leaders of your churches, the people of your church that have leadership positions would be another good way to get the message out.
We have an example here from Heidi Carter saying that a local doctor posted a video online which went viral. I've seen that also in a few of the communities, that doctors are also a source of authority. But yeah, Madeline, did you want to chime in there as well?
I would definitely, I echo everything Blair said about faith-based messaging. And I think it's also important just to maybe figure out what kind of news source or media platform your residents utilize the most, right? So as I mentioned, we have a large Spanish-speaking population down here, so we will often have people do interviews on Telemundo, which is a pretty large Spanish-speaking news organization, right? And so we'll put the judge on Telemundo or the PIO or something like that. I think it's also important to just I know we've discussed this over and over, but to really find a way to reach those vulnerable communities, right? So as I mentioned, we have a lot of rural areas where there are lower income or undocumented people, and so we will use other non-government related partners to kind of get the messaging out. So it could be faith-based, or it could just be like those community health workers or volunteers that are from the community that have some messaging, and they can go door to door or do that flyering or reach out. You don't have to have like an established position, it could just be a well-intentioned resident who wants to help get the word out among their community. And that's been really helpful for us down here as well.
Great, thank you. I think with that, we're going to just wrap up here. And I think we've had some great sessions. So you can see here the messaging takeaways. You can see that? Yeah, excellent. Excellent, great. So it's kind of to summarize some of the main points that we've heard is to really own the conversation. As we saw earlier, we saw that kind of the official sources have been lagging a bit, and now is really the opportunity to own the conversation. And we have some great tips, some great insights from Blair and from Madeline, from some of our participants today about how to do that. And I think one of the biggest things that we've heard is about going local, emphasizing those trusted voices, whether they be local elected officials, whether it be your city mayors or county executives, faith-based leaders, really to your city, but go local. And again, don't be afraid to repeat that messaging over and over and over again. As Madeline said a few days ago, just repeat it over and over and over again. So to do that, to take that away. We'll say, Zencity, we're here for our partner communities to help you track the effectiveness of those messaging. Is that message getting out to residents? Are they repeating your messaging? If you're saying it over and over again, you have to make sure everyone else is saying it over and over again, and to identify kind of where it's happening. And so we encourage you, again, as we said, there's a project active in all of our communities' dashboards now about the vaccine and about other COVID-19 issues as well. And for those of you who are not yet Zencity partner communities, please don't hesitate to reach out to us to learn more about our vaccine packages. We have a very, very quick setup time, a number of days. So please don't hesitate to reach out. And once again, I really want to thank everyone for taking the time to be with us today. Thank you again for your hard work. And especially thank you to Blair and Madeline for taking the time to speak with us today. I'll go back here 1 second for everyone's contact information to make sure if you have any questions. I know Blair wants to be a resource for all of you, and Madeline as well, to help her colleagues. So please don't hesitate to reach out for anything you need. And again, thank you all so much for being with us. Stay safe and have a great holiday season. Thank you all very much.
Thank you to everybody. Thank you all for joining. Happy holidays all.
Bye-bye.